first, we're going to have meet Amanda Glassman, Executive Vice President and the Senior Fellow, Center for Global Development, CGD, and the CEO of CGD Europe. So Amanda, you have the floor.
Thank you very much, Ambassador. I'll talk about three to four issues that I think are key when we think about the role of science, technology, and innovation to inform the SDG agenda during and post COVID-19. So I think it's never been more apparent that rigorous science and study design in the public domain is totally vital to policy and getting it right. The speedy and open publication of COVID science is such a unique and interesting development feature of the current response, but it has some challenges. These challenges existed before COVID, and I think they'll be more pronounced after COVID. So one has to do with information overload. Over the past 3 months, over 7,000 papers have been published on the pandemic, and a fifth of them happened last week, according to 3IE, a group that tracks these things. About 200 COVID-focused evidence hubs exist. And yet getting the most accurate real-time information to policymakers and clinicians is a massive challenge. We need more thoughtful curation and presentation of evidence and science, but we also need those brokering organizations that are so essential and that can be driven by the questions that policymakers need answered in the real world. I think one of my favorite examples of an organization that does this kind of brokering of information on the costs and effects of different health products or health interventions is the Thailand's Health Intervention and Technology Assessment Program. They bring cost effectiveness evidence to public health decision makers and also to health insurance coverage scheme administrators, and they serve them and their decision-making process. There are lots of examples of these kinds of brokering institutions, but I think it's something to look for and strengthen as we go forward in the post-COVID period. I think the other big piece is bad science is a real problem, especially when you're producing materials in the public domain without peer review. There have been a number of fairly prominent examples in recent weeks that have had real consequences for policy. And I think it's great to have the science out in the public domain, but we need to think of ways to hasten peer review, to be able to rate the rigor of designs as quickly as possible. To give you a sense, it was the Santa Clara study, for example, by some social scientists at Stanford that selected a biased sample to test what share of the population had COVID-19. And that has huge implications for the costs and benefits of the policies of social distancing and lockdown. But can we use data from a non-random sample? What does it tell us? What doesn't it tell us? So there's that, again, it comes back to that issue of how do we interpret study findings? How do we communicate about their limitations and use for policy? Another really interesting development, of course, are the promise and perils of digital data, from using mobility data from cell phones to understand compliance and effectiveness of social distancing and quarantine, to building representative phone-based samples on top of in-person household survey samples to understand what's happening with the economic and social policy response to the crisis. The movement to serosurveys to understand what is happening with the virus. These are all things that people dreamed of doing in the past and that are becoming reality in the present. They will transform knowledge, but they come with very serious ethical and privacy issues that need to be addressed. Probably the Europeans are farthest ahead in this issue. But in the midst of all of that explosion of very interesting and comprehensive digital data, some of the basic data is still missing. I am always struck by the very low coverage of vital statistics data in sub-Saharan Africa, particularly mortality data. So the UN Statistical Division has stated that about 60% of deaths are registered, and of those 60%, more than half have no information attached to them. They're just a death, so we don't know where they happened, we don't know age, we don't know sex, we don't know much about it. So, when we're looking to see right now what's going on with the outbreak in sub-Saharan Africa, we think the news is good, but we really don't have any idea. And so when we think of science, technology, and innovation and cool new things, I hope we also remember that there's basic data infrastructure that's needed for better science. The second important point that was also part of the Global Sustainable Development Report that I was part of with UNDESA is the need for multidisciplinarity in science. And I think I'll give you an example from COVID-19 of why this is so important, and then reflect on why it might be doubly important in the post-COVID world. So, COVID-19, there was an enormous amount of modeling, scientific modeling on the effects and dynamics of the epidemic. But that happened in disciplinary and disease silos. So for the first several months of the outbreak, we only had models that looked at COVID-19 cases and related mortality. Or we had models that looked only at the economic effects of lockdown. But the reality is that these issues inform each other. Policy to address the pandemic affects what happens in the economy. What happens in the economy affects COVID-19 cases, but it also affects all other kinds of causes of morbidity and mortality. And I think, in the presence of these siloed models and these models that only an epidemiologist or only economists, we've missed out an opportunity to have a more holistic approach to understanding what policies work best in what contexts. It's particularly important when we think of low and middle income countries where the consequences of the collapse in the global economy are so pronounced. Are we really giving the best advice to just export policies implemented in Europe to Kenya? We just don't know. And we don't have the right modeling to inform that. Actually, WHO just released some new data on this very issue. So I think it's exciting to see that kind of multidisciplinarity coming together. A similar thing could be said about, a food price shock, a natural disaster that would be on a larger scale than we've experienced in the past due to climate change. All of these things have those effects throughout all the kinds of SDG outcomes that we care about. So the question is, how can we incentivize more multidisciplinarity in science, in the modeling that we do, in the evaluation of policies to be able to inform decision makers? Okay, is my 5 minutes up? You'll text me in the group chat if my time is up, but otherwise I'll make one more point. I think the issue of innovation.
Amanda, could you stop?
Yes,
here?
I will stop and I will
Yes.
join the conversation later. Thank you.
Oh, thank you very much, Amanda. You addressed a very important point, trustful data, evidence, and multidisciplinary approaches for modeling and others. Thank you very much.